Good evening. My name is Kalea Clark. I'm doing my mental health presentation on the University Behavioral Center. So let's begin. The mission statement that I have for University Behavioral Center, I have it listed here, but first I want to talk about the facility itself. The University Behavioral Center is a 14-acre facility located in Orlando, Florida, that specializes in mental health and substance abuse treatment. This facility provides services for children, adolescents, and adults. I believe that UBC succeeds when it comes to fulfilling the mission statement, which is our goal is to enable each individual who enters our care to improve their overall quality of life in a comfortable, secure environment. These are the services that they have provided. So they have things provided for children, adolescents, adults. They have a substance abuse program, a military program, and they all include telehealth. So children aged 5 to 17 have the opportunity for individual and group therapy, gym time, and expression through art and music. There are male and female units that are available for mental health and physical treatment in a crisis stabilization situation, whether it's voluntary or Baker Act patients. With regard to substance abuse, medication-assisted detox, and there's a 12-step substance abuse rehabilitation program in place for these patients, so they do that. With regard to the military, they have a veteran program and active duty service members program, and then they also have programs for their family members who require mental health treatment, and they're all welcome. And then with regard to telehealth, all of these patients have access to telehealth along with physically seeing their physicians and psychiatrists. These are the sources of funding. So it can be by insurance, Medicare, charity care, payment plan, or self-pay. Insurance may cover in full or part of the program. Medicare or health insurance exchange may be able to cover services. They have a charity care program that is able to supply those who are at a certain income bracket. They're able to qualify for this charity care, and then they can receive treatment at no cost. There's a payment plan program where deductibles, co-pays, co-insurance, and monthly payment plans can be assessed. And then for those who don't qualify for any of this or are able to do any of this, they're able to do self-pay, and they can pay in full for their treatment. This is how the center can be accessed. You can come by voluntary or Baker Act. So this is the address here in Orlando, and it's in the Central Florida Research Park development. So it's actually on the same little street kind of as the University of Central Florida. And this is the phone number. They also have a website which is listed after this. My personal impression of UBC, this comes from an employment aspect, but before I started working there, I asked for a tour of the building. And honestly, I thought that the building was very clean, I thought it was organized, and I thought it was well managed. I had patients at UBC that were treated well, and their best interests were always at mind, and their independence was always maintained. I never felt like we were taking away their independence or, preventing them from trying to get better, just, keeping them where they are. The goal was to always make them better, to reach their own goals. Some patients actually mentioned that they have been to UBC more than once, maybe a couple times, because they felt like it was a safe haven for them when they felt like they didn't have anywhere else to go, whether it was for, their substance abuse or for their mental health issues. They felt like UBC was a place where they could go and not be judged. I felt that UBC really wanted to give patients the tools that they would need to succeed in their mental health goals, also without shaming them. So I can agree with the patients when they say that it felt like they weren't shamed or judged. And this is my reference. This is the website listed here. It's the universitybehavioral.com. So you can reach it there if you ever need any more information about it or any of its programs. And thank you. If you have any questions, please let me know.